All right, to start here, could you please give us your name and your title here at the hospital?
Okay, my name is Jody Kaler. I'm actually the lead technologist in the X-ray department.
Okay. And what would you say is a typical day for you in X-ray? Where would you be working? What type of studies would you be doing?
A typical day varies greatly, basically. We have many different areas in the X-ray department that we need to cover. We have general X-ray, we have fluoroscopy X-ray, we have the emergency room, which encompasses the trauma bay as well. So every day we have a rotation, so our technologists move from one area to the next area daily. Also in the course of the day, we can go to multiple areas, so we rotate around quite a bit.
Okay. And what was the educational requirements to get your degree to work in this field?
There are basically two different types of schooling that you can go to, the hospital-based and the college-based. I actually went to the hospital-based, which you have some courses at some courses at the college and some courses at the hospital as well, so you're getting your clinical at the same time as your hospital courses. The college-based, which has become more prevalent, is where you have your courses are at the college and then you come to your clinical site for your rotations.
And what type of locations would a person be working? Is it just the hospital?
No, there's actually several different areas. I'm actually one of the technologists that rotates around to different facilities, and I do different modalities when I'm at those facilities. So you can work at a hospital-based setting, you can work at outpatient-based settings, you can work at orthopedic clinics. There are several different avenues that you can actually move into from radiography.
Now, does radiography have any specific subsets to radiography?
Yeah, from when you take your courses as a radiologic technologist, you can actually, are you talking about the cross-modality?
Like mammo?
Okay, yep. So when you are a radiographer, you can actually do, oh my goodness, mammography, DEXAs, heel screening. That's basically.
All right. So what things about your job do you like the most?
In radiography, I think I like the variety of the day. We are constantly moving around to different areas. There's, one day you might be doing general radiography, the next day you might be doing fluoro, the next day you're in the operating room. So there's a lot of variety. You're not doing the same thing day in, day out. But I think my favorite is probably the traumas and the variety that comes with working in the trauma setting.
All right. What things about your job do you dislike?
Oh my, I guess if anything, I'm not really a big person for call, but I know it is a requirement of the job, so I do it.
Okay. Can you take us for a little tour of the room and explain a little bit of how the modality actually works?
Sure. This is actually our general table. This is where we would do spine x-rays, you can do rib x-rays, pretty much anything that would require the patient to be lying recumbent on the table or prone on the table. This other piece of equipment over here is our vertical bucky. Anything where the patient is required to be standing would be done on this unit itself. So we do lots of chest x-rays, rib x-rays, anything where the patient's standing.
And how does it work? What is the science behind how X-ray works?
X-ray uses X-ray radiation, basically. So this is a wireless receptor, so as soon as we take the image will come up behind the panel back here. We can take a look at the image, make sure that we have all of the required anatomy for the radiologist. And once we complete the exam, then it will wirelessly be transmitted back to the radiologist for the dictation.
So how are X-rays created? Inside the housing that you see here is a tungsten filament. A very high current is passed through that tungsten filament. As the tungsten filament heats up, the electrons in the tungsten are released and sent forth through an air passage into another tungsten filament. That tungsten filament spins and slows down those electrons. As the electrons slow down, their kinetic energy is released in the form of X-rays. Those X-rays then pass through the patient into the receiver, and the negative space is recorded on the other side. Those images are sent back to a processor to create an X-ray image.
All right. And Jody, do you happen to know what the job market is like for radiographic technologists right now?
Honestly, I would say that the job market is pretty good. I know there's a couple of facilities that are currently in the process of being built, so they will require, new radiographers. Also, there's always a high turnaround rate. It kind of moves in cycles because of technologists choosing to advance in their career, move on to like CT, MRI. There's always opportunities to turn, there's always opportunities where jobs are opening.
Okay, great. All right, Jody, thank you for your time. Okay, can you please state your name and your position here at the hospital?
Hi, I'm Rhiannon Reynolds, and I am a CAT scan tech here at Penn State Holy Spirit Hospital.
Right. And how does one become a CT tech?
So CAT scan is a branch out of X-ray. So there are certain modalities that you need to become an X-ray tech before you're able to cross-train into another area. CAT scan would be an area that you would need to have X-ray as your base, and then you could take additional classes and do another internship to get compositions done to become a certified CAT scan tech.
Right. So what type of locations would a CAT scan tech work in?
CAT scan actually has a lot of various areas that you can work in. There's the hospital setting that would be the most common and most used. There's also outpatient surgery centers that have CAT scans available to doctors to do pre and post-op testing. There's outpatient clinics like orthopedic offices, as well as just general locations that have imaging for routine outpatient studies.
And are there any subsets to this modality?
So CAT scan is a general certification, unlike some other modalities where you sit for other boards. But the subsets that you can kind of branch out into would be within the hospital setting, biopsies and drains. It's kind of something that most techs end up learning farther on in their career once they've established the basics. There's also cardiac imaging that uses the CAT scan machine to look at the heart and the blood flow out through the body for different surgeries that they would do. So they use a gated study where the heartbeat is measured and the injection is done with the heartbeat. So it's a little bit different than your traditional CAT scan. And there's also perfusion studies that can be used to watch blood flow through the brain for different reasons.
Okay. And what do you think a typical day in the CT department looks like?
For us here at the hospital, our day typically starts out, for the most part, kind of average, a little slower. But with us having the ER setting and being a trauma unit, it can quickly change. So it's a very dynamic atmosphere to be working in, changes constantly. And I would say that for the most part, we are going pretty much nonstop, all but 24/7.
So what does the job market look like for a CT tech?
Prospects in imaging right now, given the current world situation, is pretty high for CAT scan as well as other modalities within radiology.
So what things do you really like about your job?
One of the things that I definitely enjoy with CAT scan is just the vast range of things that we see on a daily basis. So with us doing inpatients and outpatients and traumas, you can see a lot of different injuries from the trauma aspect, as well as some interesting things like if someone has cancer and it's gone from a primary site off to a secondary area, you can see what that's like. It's interesting too on the cancer end, we do staging for people, so we kind of see them every few months, so it's nice to see how they their treatments are going for them. And with biopsies and drains, it's kind of a more outside the box thinking that you do, and you might not see things there that you would normally see. You might be kind of helping with a small procedure versus a patient going to the OR, so it kind of gives you an insight into different areas in the medical field.
Great. What things about your job do you not like?
Sometimes with the fact that we're a trauma unit and we're juggling a lot of different hats, for a way of saying it, it can be overwhelming sometimes whenever you have, say, 5 traumas coming at one time, the ER is also busy, and you also have outpatients. That hecticness sometimes can get a little cumbersome, but it keeps it entertaining.
Okay. Rhiannon, could you give us an overview of the equipment and some of the basic science of how CAT scan works?
Sure. So as you can see behind me, this is one of our CAT scan machines. This is a modified 64 slice. And what that means is it captures 64 pictures at one time for each revelation that it makes. So if you look into the inside here, it's circular, and there's an X-ray tube that is on one side of the circle, and then there's detectors that are on the other. So that tube's responsibility is to heat up and emit X-rays as a byproduct of that heat that are then projected across the patient as they go through the machine, and those detectors will catch that X-ray. And then it also spins the whole way around them. So the difference with a CAT scan image in the X-ray production versus a general X-ray is that you get a 360-degree view around the patient versus just a single flat image. We also have an injector that we use for some studies, and it has 2 different liquids in it. One is contrast and one is water. So it can be confusing because they're the same color, so it's important to know which is which. But the contrast will show up bright white inside a patient when we inject them, and we'll actively take pictures as they're being injected so that we can see blood flow out to organs. We can see if something highlights bright white that shouldn't, and it gives us a better understanding of what might be going on with the patient.
All right. Wonderful. Thank you so much for your time, Rhiannon.
You're welcome.
All right. Can you tell us your name and your position here at the hospital?
My name is Robert Ritt. I'm the lead technologist in MRI.
All right. So, Bob, what kind of educational requirements would there be for MRI?
So in MRI, of course, you would need a high school education and diploma. And then, generally, in MRI, you go from X-ray to MRI, or X-ray to CAT scan to MRI. So you would go to a X-ray school. Most of those are either a 2-year program or a 4-year program now. And then you can then cross-train or go to an MRI school, which would be an additional 2 years. But if you can get into a cross-training situation, you can do it a lot quicker. You can get your competencies done by the people that are cross-training you, and then you can sit for the ART registry in MRI.
All right. And what does a typical day in MRI look like?
A typical day in MRI differs depending on whether you're an outpatient or inpatient. Outpatient, you have a set schedule and you just try to maintain the time slots and stay on time. In inpatient, you have inpatients, emergency room patients, and outpatients that you're trying to intermingle and juggle. And you just try to adjust and be flexible and stay on time if you can, but sometimes you get behind. You just have to be flexible and just be willing to juggle things.
And what kind of studies would you be doing?
In MRI, we can scan anything from head to toe. We can scan anything but air, so we don't do lungs and sinuses generally, but anything else is free game for MRI.
Are there subsets to MRI?
There are subsets to MRI. Most facilities, since the equipment costs so much, will do pretty much any body part, but some bigger facilities will set aside a magnet specifically for cardiac scanning or breast scanning, and some technologists will only do that type of scanning day in and day out.
All right. Are there subsets specifically to MRI?
Within MRI, there are subsets like you can have neuro, you can have orthopedic. Some offices only do those types of studies. Children's hospitals will specifically scan children. There are folks that just scan on mobile scanners, so you have some different things. Most facilities are hospital-based, but some are privately owned and some are physician-owned, so there's a good bit out there.
Okay. And what do you like most about working in MRI?
I like it's a challenging modality. I went through X-ray and then into CAT scan, and of the three, I like MRI the most. With its challenging technology, I find it very fun to play with protocols and to make things better and not necessarily faster, but do things better than we've done in the past, and just to see the anatomy much better.
Right. And what things do you dislike?
The frustrating part sometimes is not being able to stay on schedule. Sometimes dealing with people that move or are claustrophobic, but it's just a matter of working with them. That's more frustrating than it is a dislike.
All right. And can you give us a rundown of how MRI works?
So MRI is based on a very strong external magnet. The magnet behind me is a supercooled magnet. It has a jacket of liquid helium that cools a coil that electricity flows through. This particular magnet was ramped up back in 2004 and has not ceased to be a magnet since. It is a superconducting magnet. It's 1.5 Tesla. So when we put the human body in this magnet, there are hydrogen protons which have a north and a south pole, will actually align to this external magnet and precess or wobble at 64 megahertz. We can then send in sound using an RF amplifier and pulse that sound and get them to dance and turn sideways in predetermined times, and then we can sample a signal from them. They actually generate a signal in the antenna or coil that's near the body part that we're scanning. So we take those frequencies and then plot them and make an image out of them.
And what is that sound that we're hearing?
The sound that we're hearing right now is a helium pump that keeps the jacket of liquid helium up to a certain pressure so that this superconducting magnet doesn't lose any of the cryogen product. So that's always chirping. Even when the power goes off, it runs on emergency power.
All right, great. All right, thank you so much for your time, Bob.
You're welcome. Thank you.
Okay, if you can give me your name and the modality and your position title here at the hospital.
My name is Stephanie, and I am the lead sonographer here at the hospital.
Okay. So, Stephanie, how does someone become an ultrasound technologist?
So to become an ultrasound technologist, you do need to go to college. The program is about a 3-year equivalent, and you come out with a specialized degree specifically in ultrasound.
Is it possible to get a bachelor's in ultrasound?
You don't get a bachelor's in ultrasound specifically, but you can further your education and do like healthcare management, something to that effect.
So what types of locations do ultrasound technologists work in?
Ultrasound technologists can work in various areas. You can work in a hospital, you can work in outpatient facilities. There are maternal fetal medicine outpatient centers that do strictly obstetrical work. You can work in a vascular office with some vascular surgeons. You can also work in cardiology doing things like echocardiograms. So there's a wide variety of places that you can work. Even some private practices, private doctors' offices have their own sonographers in office.
And what are some of the subsets to ultrasound?
So when you go to ultrasound school, generally you pick one of 3 tracks. The general track includes all of your general studies, so abdomens, pelvises, all small parts, and many other things. You can go into the cardiac track, which includes echocardiograms, and that's pretty much its own specialty, or a vascular setting, and that is things doing veins and arteries in different parts of the body. So arms, legs, abdomens, carotid arteries, things like that.
What does a typical day look like for you?
For me, since I work in a hospital setting, we do a variety of things. Our department is pretty special because we do the general and the vascular work for the facilities. We don't have a separate vascular department. So in a day's time, I can do anything from an abdomen, a pelvis, a baby, to scanning veins and arteries in legs and arms. We also do biopsies with our interventional radiology department, and we also go to the operating room to help out the OBGYNs with certain procedures. We can also go to the cath labs and the vascular ORs to help the surgeons get access to whatever it is they're trying to open up.
Would you say that ultrasound is pretty fast-paced?
Yes, definitely.
So do you happen to know what the job market looks like for an ultrasound technologist?
I would say most of our students are getting jobs within a few months post-graduation. Recently, we've actually hired a lot of our students even prior to graduation, so they graduate and already have a position for them.
So what things about your modality do you like the most?
I like the variety. I don't get bored during the day because we do quite a few different types of exams, so I'm not doing the same thing all day, every day.
And what things do you dislike?
Dislike. There's not much that I dislike. There are sometimes specific exams that people don't really like to do, so that could be a dislike. Some days we're very fast-paced and constantly behind because some of our exams do take a longer period of time, so just playing the catch-up in the department for the day.
So can you give me a quick overview of your equipment and the basic science of how ultrasound works?
Sure. So this is our machine. We have different, what we call transducers, so different cameras, and each camera is for a different exam. So this is called a linear probe. This is what we use for most of our vascular work, so looking at veins and arteries. This is a curved probe. This is what we use for abdomens, pelvises, when we scan babies, things like that. The difference between the two is kind of the penetration settings. So because we're going a little bit deeper in the body, this one works better, and we don't have to go quite as deep with this one, so we use this. The basic science is there's a crystal in here. The machine produces sound waves, injects those waves into the body. Those waves bounce off the solid organs and then transfer back to the machine, and that's how we get our image.
All right. Thank you so much for your time, Stephanie.
Thank you.
Okay, can you please give me your name and your position here at the hospital?
My name is Scott Edwards. I am X-ray tech, CT, IR tech here at Holy Spirit Hospital.
Okay, and today we're going to be talking about interventional radiology. So how would someone become an IR technologist?
First, you do have to start out with an X-ray certification. So you become an X-ray tech, and depending on your location, you can express interest in the IR field, and if there's an opportunity, then they will take you on as a cross-train.
Right. So IR comes about as X-ray first, and in hospital training into IR?
Mm-hmm. Yeah, in hospital, and you can also go to ASRT and buy the modules for IR, so you can complete a module set so you can be board eligible to take board exams, because you would eventually have to be certified in interventional radiology.
So what types of locations do people work in when they work in IR?
I believe IR is strictly hospital, but there may be some outpatient clinics that would do procedures for outpatients, but typically it's an in-hospital setting, pretty fast-paced.
And what types of studies does an IR technologist do?
Well, we assist a radiologist using ultrasound, X-ray, sometimes even CT scan. Mainly it's gaining access to vessels or cavities or infections, placing catheters, placing lines, using the ultrasound for access, and then using the X-ray to confirm placement.
And what does a typical day look like in IR?
Well, we come in the morning, we get our outpatient schedule ready. We typically have a handful of outpatients per day. And of course, being attached to a hospital, we get lots of inpatient orders from hospitalists, general surgery. We have nurses that help us out and everything, so they coordinate how we fit in inpatients. So it's kind of a mix between outpatients and inpatients.
Do you do patients from the emergency room?
Yes, sometimes. They'll have some sort of workup in the ER for CAT scans that would reveal a bleed somewhere in the body, internal. So we would certainly fix that if need be.
What does the job market look like in IR?
I think it is a growing field, so I would think that in the coming years it's going to be getting bigger and bigger. It's minimally invasive surgery, so it's always a benefit to just stick a needle and insert a wire rather than making an incision and cutting a patient open. So I do think it is a growing field. I think it's something that will be, it'll grow.
What things do you like about your modality?
I do like that it is sort of fast-paced. Things can change very quickly. You can have a nice, easy day, but some sort of emergency happens and you gotta kick into gear. And there's a lot of knowledge from the radiologist that you can gain.
And what things do you dislike?
Well, there are stressful days like any job. So sometimes you're caught in the middle. You're assisting the radiologist, but then you also have nurses that are trying to do what they need to do. So it gets stressful, but you can always handle it.
Right. So Scott, if you could give me a quick overview of some of the equipment that you have here and what you would use that equipment for.
Okay. Well, a lot of times it does start with ultrasounds. We use the probes. This would be a vascular probe for vessels to gain an access. And this is more of a soft tissue probe to look for maybe a large collection of fluid to gain access to. So typically starting with ultrasounds, we have the patient draped on a table sterilely, just like an operation room. The X-ray then is used to verify placement to make sure the wire or the catheter is where it needs to be. Sometimes we use not IV contrast, we just use contrast that we just inject into our catheter to verify placement. Sometimes CAT scan is also used. That's in a different room. The radiologist will be right there with the CAT scan tech, taking images and placing a catheter or a line.
So it sounds like IR gets to use everything that radiology has available.
Yes, it does. It uses pretty much every modality. Nuclear medicine is used, but it's not really used during a procedure. It's usually a pre-op imaging study. But we do use all modalities. That's something I like about it, is that you use all different types.
All right. Thank you so much for your time, Scott.
Tell me your name and your position here at the hospital.
My name is Travis Barner. I'm the lead nuclear medicine technologist here at Holy Spirit.
And what is the educational requirements for someone looking to get into nuclear medicine?
So there are two different ways that someone can become a nuclear medicine technologist. There is a 2+1 where you would go to college for 2 years to get a lot of your basic courses such as anatomy and physiology, chemistry, physics, things like that. And then there's an additional year where you would do clinicals, and you would do clinicals 4 days a week, and 1 day a week you would do additional classes at the nuclear medicine school that are specific to nuclear medicine physics, radiopharmacy, that sort of stuff. And the other way that you can become a nuclear medicine technologist is through a 4-year degree. So there are bachelor programs that are available that you can go to for nuclear medicine where you do 3 years of college classes and 1 year of clinicals and nuclear medicine specific classes.
All right, and what does a typical day in nuclear medicine look like?
So typically in nuclear medicine, we start our day around anywhere sometimes from 6:30 to 7:30. We come in, We do quality assurance on all of our cameras. We do quality assurance on our dose calibrators, our uptake probe, and after we're done with our quality assurance for the day, then we start scanning patients. Typically, the way that we do that is in the mornings, our day is much heavier as far as injecting patients, dosing patients with radioactive pills, things like that. And then later on in the day, a couple of hours later, we would scan them after the things that we injected or had them, pills that we had them take, do the thing they need to do, and we would scan them later that day. So sometimes we can be doing brain death studies, we can be doing bone scans to check skeletons for cancer. Sometimes we can be doing liver studies or gallbladder studies or cardiac studies. So there's a large variety of studies that we could be doing in a day.
And are there any subsets to nuclear medicine that a person could go into?
Yeah, so you could do general nuclear medicine, which is primarily what I do here in the hospital setting, where we do inpatients, we do outpatients, we do patients from the emergency room. And like I had said before, we could be doing any type of study. We could be doing cardiac studies, we could be doing bone studies, we could be doing gallbladder studies, cerebrospinal fluid studies, we could be doing any number of those here at the hospital. There are also subsets where you could be doing cardiac nuclear medicine, where the only thing you do all day from start to finish is imaging people's hearts and looking for areas of insufficiency. There's another subset that is really taking off right now, which is PET-CT. And PET-CT is a special kind of nuclear medicine. It uses a technology that's a little bit different. And it combines that with a CAT scanner. And then it takes the nuclear medicine information, which is functional information, and it overlays it with a CAT scan, which is anatomical information. And you get a really nice image of what the body is doing and what organs are doing it.
And what do you like most about working in nuclear medicine?
So the things that I like working in nuclear medicine, I like the variety of studies that we end up doing. So unlike some of the other modalities where you're sort of using the same type of technology and just adjusting your parameters to take a look at the organ systems that you want to, with nuclear medicine, we specifically give a radioactive isotope, radiopharmaceutical to a patient, and then the imaging that we do is specifically based off of that radiopharmaceutical. So like I said, sometimes you could be doing bones, hearts, brains, spines. If there's any number of studies that we can be doing, it's very different for every study that we do.
And what do you like least about working in nuclear medicine?
So the thing that I think that I like the least about nuclear medicine is being on call. So sometimes after you're done with your day, you're not done with your day, because you could be on call for the evening into the next day, or you can be on call over a weekend. It does take up some of your time, but at this point, it's pretty much required no matter what type of medical field you go into. Usually if it's hospital-based, you're going to have some type of call.
Right, and can you give us a quick rundown of the science of how nuclear medicine works?
Sure. So in nuclear medicine, the way that it works, the way that we get our radiation that we take our images with, is we inject the patient or we have them swallow a pill, and inside of those chemicals is a radioactive isotope, which for nuclear medicine typically is an isotope called technetium. Technetium is a radioactive isotope, so it releases radiation all on its own. So what we then do is we take that isotope and we tag it to a radiopharmaceutical. And the pharmaceutical takes it throughout the body to a specific organ system, and it lets us image that organ system. So for example, with a HIDA, we inject them with a chemical that's designed to go to their liver. Their liver pushes it out into their gallbladder tract, and then we watch their gallbladder to see whether or not it fills up, and that lets us know if it's infected or if there's some type of problem with the function of the gallbladder. Another example would be with bone scans. We use technetium combined with phosphorus, and your body utilizes phosphorus to regrow new bone. So we give them the isotope, we wait 3 hours. In that 3 hours, their body turns over some bone and utilizes the radioactive isotope to regrow that new bone, and then we get the ability to image them head to toe for their skeleton where their body has recreated new bone. Now, inside this machine, the way that that works is inside of here there is a crystal. The crystal lives about at this level. That crystal, when it gets hit with a radioactive ray, will then turn that radiation into a light beam. The light beam goes up into this part where there are things called photomultiplier tubes. The photomultiplier tubes increase the light, and then they send that back onto something that detects that and turns it into an electrical signal. The electrical signal, dependent upon what photomultiplier tube it was hit and where it was hit, will then calculate the origin of that radiation ray and will give us a 2D image. So there's another way that we can do this too, where these two cameras rotate around the patient, and that gives us an additional plane that we're able to look at the patient, and it will give us a 3D image. So that's how that works.
All right, great. Thank you for your time, Travis.